I will start the evaluation of cardiac risk prior to non-cardiac surgery. I assume that the slides are visible for you and I'm audible. So essentially what we are going to try and do is evaluation of the cardiac risk for a patient who comes in for non-cardiac surgery. This has been a huge takeoff from the ACC AHA presentation or the publication that came up in which started coming up. The last one that I think appeared is in 2014. We have had few focused updates after that and possibly awaiting a newer one. But till then, we'll have to deal with that. Plus, there are certain things which are not there in the ACC AHA, which will possibly we will deal with it over here. We all understand that major non-cardiac surgery, there is always a risk of cardiovascular event. And the risk of cardiovascular event is related to the patient. So there are certain patient-specific characteristics, especially those who have a background cardiovascular disease, and also the procedure involved. And identification, which is the essential premise of this next half an hour, 45 minutes. This identification of the risk provides the surgeon, the patient, the anesthesiologist with information that helps them better understand the benefit to risk ratio of that particular procedure, and therefore helps them to take a decision as to whether they would be happy to take that increased risk or there is no risk at all and we can possibly go ahead. And it can also lead to intervention that can possibly decrease the risk. If you look through data, and this is from the American College of Surgeons, the National Database on Quality Improvement Program, and they looked at their data from 2004 to 2013. And when they looked at non-cardiac surgery, they're looking at major adverse cardiovascular and cerebrovascular events, that is in-hospital, all-cause death, acute MI, or acute ischemic stroke. It is happening in the rate of around 3%. So that's not an insignificant rate. That's pretty significant. And these were happening more commonly in patients undergoing vascular surgery, thoracic surgery, and transplant surgery. So that is why we need to be aware and be careful about this. So what we will go through today is the approach of a patient and looking at the patient, looking at the surgical procedure, how we do the initial evaluation, what are the risk factors, how can we do the risk assessment, and the management based on risk is what flow that we take in. We will not possibly deal with it, and then you will not go to bed by 12 midnight tonight. So we will not discuss about how you can, somebody with a problem, what you do to manage it, but rather the flow through which the patient should go through. And is there any role of doing further cardiac testing? So this is what we will try and go through, a practical approach. Before we start the deliberations, we will have certain poll questions. This is fun. This is to kind of make it interactive. So if you can, Jyoti, if you can get the poll questions ready, we will go through the poll questions.
Yes, sir.
Thank you very much. So all you have to do, this is completely confidential. It is not revealed who is hitting which option. So please feel free to hit it, and we will go back to it, which is essentially the take-home message from the deliberation will be the answers to the poll questions. So the first poll question that comes up is, which of these statement is not true? So one of these is not true, okay? All patients scheduled to undergo non-cardiac surgery should have an assessment of the risk of cardiovascular perioperative cardiac event.